Imagine living with pain so deep. It feels like your body is turning against you. You wake up, you smile, you push through, but inside, it feels like knives twisting in your abdomen. Doctors tell you, it's just cramps. Friends say, maybe you're overreacting. But it's not just cramps. It's not in your head. This is endometriosis, a condition that affects roughly 1 in 10 women globally. Yet many go undiagnosed for 7 to 10 years. Let's talk about what really happens inside the body, and why this silent disease deserves to be seen, heard, and understood. Inside the uterus, there's a special lining called the endometrium. It's what thickens every month in preparation for pregnancy, then sheds as your period when pregnancy doesn't happen. But in endometriosis, some of this tissue, or something very similar to it, starts growing outside the uterus. It can grow on the ovaries, fallopian tubes, bowels, bladder, and even in rare cases, the lungs or diaphragm. Now imagine this tissue bleeding every month, but with no way out of the body. The result? Inflammation, scarring, and pain that can become chronic. It's like having a wound that keeps reopening, month after month, silently. So why does it hurt so much? Here's the science. Those misplaced tissues respond to hormonal signals, mainly estrogen, just like normal endometrium. But trapped inside the pelvis, they trigger an inflammatory reaction, releasing chemicals called cytokines that irritate nearby nerves. Over time, your nervous system becomes hypersensitive. It starts sending pain signals even when there's no active damage. That's why the pain feels so intense, so unpredictable, and why over-the-counter painkillers often do little to help. Endometriosis pain isn't just period pain. It's a neurological, hormonal, and immune storm happening inside the body. The symptoms go far beyond cramps. They can include chronic pelvic pain, painful sex, heavy or irregular bleeding, fatigue bloating, often called endobelly, pain during urination or bowel movements, difficulty conceiving. And here's the painful truth. These symptoms are often dismissed. Girls as young as 13 are told, it's just part of being a woman. But no, constant pain is not normal. Pain that stops you from living your life, going to school, or working is not normal. On average, it takes 7 to 10 years to get a proper diagnosis. Why so long? Because endometriosis can mimic other conditions, IBS, urinary infections, or even psychological issues. Some doctors still believe it's rare or exaggerated. But here's the thing. It's neither. It's just under-recognized. The only way to confirm it 100% is through laparoscopy, a surgical procedure using a small camera inside the abdomen. Imagine waiting nearly a decade just to hear what's been wrong with your body all along. That delay alone can cause emotional damage, anxiety, depression, self-doubt, because you start to question your own pain. Endometriosis doesn't just affect the uterus. It affects relationships, careers, dreams. Many women lose jobs because of frequent sick days. Some struggle to conceive. Intimacy becomes painful, both physically and emotionally. And then there's the silent suffering, smiling through pain to appear normal. That's why awareness is so important, because when society believes you, you begin to heal. Not just physically, but emotionally too. There's no single cure yet, but there are treatments that help manage symptoms. Doctors may use hormonal therapies to reduce estrogen and shrink lesions, pain medications to manage inflammation, surgical removal, laparoscopic excision for severe cases, fertility treatments for those struggling to conceive. Lifestyle also matters. Anti-inflammatory diets, gentle exercise, and stress management can make a difference. And new research is underway, exploring genetics, immune factors, and new drugs that might one day offer lasting relief. So yes, there's hope. Endometriosis is invisible, but it's not imaginary. Behind every woman who looks fine might be someone fighting silent wars inside her body. We owe them more awareness, more empathy, more research. So if you're watching this and it sounds familiar, please don't ignore it. Talk to your doctor, Ask questions. Keep pushing until you're heard. Because your pain is real, your story matters, and you deserve relief. Share this video, not for views, but for voices that have been silenced for too long. Let's break the stigma around period pain. Let's make conversations about menstrual health as normal as talking about the weather. Because every woman living with endometriosis deserves one thing above all: to live without pain and to be believed.